Hello and welcome to Where the Road Rises with me, your host Eileen Curlin-Walsh. Since 1949, this has been Mental Health Awareness Month, and we often mark the occasion here on Channel 4 by exploring the challenges of those living with or caring for someone with mental, behavioral or emotional disorder. 1 in 5 US adults lives with a mental illness ranging from mild to severe. Our guest today, Maureen Raffa, amongst her many accomplishments and qualifications, is a board-certified psychiatric nurse with knowledge of the provider network and community services available to our families in need of mental health support. Maureen is on the board of the American Psychiatric Nurses Association and on the board of our beloved Plows here in Palos Heights. And we are honored to have her share her insight and solutions with regard to mental health problems with us today. Welcome, Maureen.
I'm so glad to be here.
Maureen, let's start with a little bit about you and your story and how you came to the field of psychiatric medicine.
Well, interestingly enough, I went to nursing school thinking I was going to work in OB, you know, mother, baby, and teach Lamaze. And in school, though, we had a wonderful, wonderful psychiatric mental health instructor. And she really, and we had an excellent clinical experience. And actually 4 of us from the rotation I was in went into psych nursing following nursing school. So, and I think later, because of learning more and more, you know, that's just the tip of the iceberg in school, and once you're out working, you really get a better understanding of diagnoses, behaviors, treatment, and recognizing, you know, your own family and your own family members with issues. And so it's really between psychiatric and the geriatric population, that's pretty much been my nursing career.
Oh my, and how wonderful. If only that instructor knew that by being so good and so inspirational, so many of you come into this important field because of her. Maureen, tell us a little bit, and I know it's a vast subject and you've spent many years in the field, but could you tell us a little about the difference between personality disorders, mood disorders, the autism spectrum? There's so much for all of us to understand. Could you break it down a little bit?
A little bit. Personality disorders, years ago they used to be called character disorders.
Interesting.
But so our personality is kind of ingrained in us, but it's kind of how we view the world and our take. But when you have a personality disorder, it's actually a maladaptive, an inflexible, rigid way of thinking and behaving. And there are actually about 10 of them, and they're broken into cluster A and cluster B, depending on you know, their behaviors, their symptoms. A couple of the more common ones, actually, that I think people can recognize because they see them all the time, they work with people with them. One is the narcissist. And that is somebody who's really all about themselves. It's big ego, they are the best, no one can do anything like them, braggadocious.
Yes.
And then the other one is the obsessive compulsive personality disorder. Now this is not the disorder with the hand washing. That's actually a more serious diagnosis. The personality, these are the people that we call the control freaks. They are the ones that want to be in charge, want to be in control. It's their way or the highway, very rigid, very inflexible. They're the rule followers. I mean, to the extent that they can't bend at all, even when, you know, it may be appropriate to bend the rules a little bit. You know, there is borderline personality disorder as well, which is probably one of the most difficult and most challenging. And that's another way of thinking of the personality disorders. These are the difficult people that you come across in life.
And is autism, is that something new in the last 20 years, or do we use new terminology for the underlying mental health illnesses that have been there for a long time, Maureen?
Autism is not new. I think we're seeing it diagnosed more frequently, and that can be a number of reasons. One, again, awareness. People are more aware, and they're seeking help. They're, they're asking the questions. I think another reason is we also have a bigger population, so therefore you'll see an increase in anything. But autism is usually diagnosed by the age of 2, and there is treatment. If you get early intervention, it can be very helpful. Applied behavioral analysis, and it's really just a lot of behavior modification. It's working not only with the child but with the parents so they can reinforce.
Right.
And then they get the school system involved too as the child gets older, so that everybody's on the same page with how they're going to respond and react.
Beautiful. And are these mental illnesses genetic?
Yes. Just like really most anything else, there is a genetic link. Now, that doesn't mean that everybody in the family gets everything. It's in one's DNA that you get from, both mom and dad. However, lifestyle choices, stressors, life stressors, different people go through different things in life. Have they learned coping skills? There's a lot of reasons that somebody in the family may not ever really see them come out.
Yeah. And we had said in the preamble that 1 in 5 Americans have some form of mental illness. I would say, Maureen, in my professional and personal life, I would say my experience is it's more like 1 in 3. So is mental illness more prevalent in our modern times, or is it, as you mentioned earlier, maybe better diagnosed? Is it an epidemic?
I think there are some epidemics, like the opioid crisis has become, I would consider that an epidemic. With mental illness, again, I think people are becoming more educated, more aware, and the younger populations are more open to seeking help and treatment. They don't feel the shame that previous generations have. Many years ago, these were the family members that were hidden in the attic. They, or locked in the closet, and thank God we've come a long way with stigma. However, we still do have a ways to go.
Oh, and isn't that so important, Maureen, that we come away from that idea that something is wrong, something is shameful, or that somehow this was caused, by something that happened in the family. It's really an area where we have a long way to go, and we do have, even if it is 1 in 5, that's a huge part of our population that needs a lot more compassion than they're currently getting. But we're getting better, is what you're saying.
Absolutely, we are getting better. And mood disorders, now that's your depression and your anxiety. And again, there's subsets. It could be a major depression, it could be a major depression, single episode, repeat episode. Could be with psychosis. We can go into a whole subset, but it's recognizing depression. And again, these are people that have a prolonged sadness. They have a lower energy. They're finding it difficult to get out of bed in the morning and face life and face, going to work. And they have sleep and appetite changes. Some sleep too much and eat too much, and others don't sleep at all, or they wake up often during the night. They're not getting a good restful sleep, and some lose their appetite, and so they tend to isolate, and they might be really irritable too, and so they tend to push people away. And so it's really important, I think, for people to know that you don't want to give up on them. You want to help them recognize that they need help.
And are those the signs that someone does need professional help?
Yes.
The prolonged sleeping, the lack of appetite, the inability to go about their daily activities?
When it's really starting to interfere with your life and your relationships and work, yes, that's definitely when professional help is needed.
Yeah. And can you speak a little bit more into the impact of one family member having a mental illness on the entire family?
It definitely does impact the whole family, not just with the mental illness, but also, if you want to bring in substance use disorders. It definitely impacts everybody. It's a challenge. Again, not all family members may have a good understanding of the illness. They want to, they think that they're doing things on purpose. They, the old expression, just pull yourself up from the bootstraps.
Yeah.
And yet it's a mental disorder. There are changes in the brain chemistry that are leading to these different types of mental illness.
Yeah.
And so, so it is hard, and oftentimes the family will give up on the patient, the identified patient.
Yeah.
And also the identified patient may be the one with the most symptoms or the most behaviors, but that doesn't mean that other family members don't have some of that, but maybe they're just able to function better.
Yeah. And is it your experience that there are often more than one family member affected?
Absolutely, but again, there may not always be, but varying degrees.
And Maureen, you mentioned substance use disorder.
Right.
I think we all have a perception that there is a link between substance use disorder and mental illness. Is that in fact the case?
Well, they've often said which came first. Did the depression lead to drinking or other drug use to make them feel better? They were self-medicating. Or did they start, and they had that addictive personality, so did they start using alcohol or other drugs? And because of the detriment that, the abuse leads to, they're losing jobs, the family is saying, hey, I want a divorce if you don't go get help, that type of thing. So if they don't, so does that lead to the depression because they start losing jobs, family, their home, relationships are so key.
And what are the treatments available? What help is out there?
Well, there is individual therapy where you can see a therapist like a licensed clinical social worker or licensed clinical professional counselor, psychologist, and they have cognitive behavioral therapy. It's considered talk therapy. So you're basically trying to change the negative thinking that goes along with these illnesses. And if the thinking changes, the behavior will change. And sometimes they say if you can change the behavior, the thinking will change. But there's exercises that you work on. There's homework assignments. You have to be motivated. You have to have some level of insight in order to work with therapy. But you also may need medications. And especially the more severe the depression is or the anxiety. And so there are antidepressants, there are anti-anxiety meds, there's also antipsychotics, because some people, their depression can be so severe that they're psychotic. It's not just schizophrenics that hallucinate or have delusional thinking. If somebody can be psychotic depressed or psychotic manic. And so medications also can be very useful. But in addition to medications, because some people actually don't respond to antidepressants, there's electroshock treatment, which is actually very humane these days, very safe. They're medicated. And there's also a new one called TMS, transmagnetic stimulation, and that's done outpatient in the doctor's office. They literally put a magnet in the area of the brain that they believe is going to be impacted, and it's almost like a woodpecker pecking.
Yeah.
And one of the things that's different from so many of our medical illnesses with psychiatric is that we know things work, but we still don't fully understand why. But we know that the synapses somehow get realigned. Our synapses in the brain, the norepinephrine, the serotonin, the dopamine, and things start working better and people feel better.
And now what if someone is getting treatment and they have a flare-up or an attack or whatever the appropriate word be used? It's not acute enough to go to the emergency room, but still it's too far out to wait until their next meeting with their counselor. Are there some tools, some self-help tools they can use in between?
Absolutely. There's a lot of useful books out there. There's an anxiety workbook you can get, a depression workbook, and again, it's exercises to work through it. Depending on your age and your insurance, there's even some online tools available with certain insurance companies.
Okay, and that brings up a very important question, which all of us would be wondering if we or someone in our family needs this help. What kind of coverage is there? Does Medicare, does Medicaid, does our normal insurances through our workplace insurance, do they recognize and cover these kinds of treatments?
Yes, they do.
Wonderful.
Now, TMS might be a little iffy because it's a newer treatment, but I know some of them do cover it.
Yeah.
But they definitely, now to the degree that they cover it, usually they still want people to meet medical necessity criteria. So no matter what level of treatment you're getting, whether it's inpatient or IOP or PHP or just straight outpatient, you have to meet criteria or a continued need. But you do need to do that even with medical illnesses too.
Yeah.
So as long as the criteria is there, then they should continue to pay. But even Medicaid does pay for treatment.
And can these conditions be cured, Maureen?
We usually generally say there is no real cure, but yes, they can be managed. And that's the key. They can be managed if people stay with the treatment plan, if they take their medicine if need be, and take it appropriately. And in addition, though, to the medication and the therapy, exercise is very useful, especially for depression and anxiety. Physical activity, it also helps lift those and connect the synapses better. You know, they talk about the runner's high, that's why. So it does help boost your mood.
And Maureen, I like when you talk about depression and maybe the alcoholism or a little bit too heavy a drinking that goes with it, because I think it takes the idea of mental illness from these words out of an encyclopedia and right down into a lot of our lives. It makes us realize that not only is it not as stigmatized as it used to be, but there's very few of us that don't see that in our family, in our friends, in our professional lives. And speaking of professional lives, do you think we professionals, do you think we're educated well enough in the community to recognize the signs and symptoms of someone with mental illness? And I'll tell you, Maureen, something that occurred to me recently. Every year as an attorney, as I'm sure you do with your profession, also we go to continuing education. And it's only been in the last 2 years that I have noticed they're putting in components now to help us, recognize mental illnesses and the use of substance that can be in our profession, but also how to recognize it in clients and how to deal with it in clients' families. Do you think we could do a better job of training? I believe Walgreens is also implementing a program to help their pharmacists recognize the need for maybe an undiagnosed mental illness. So I wonder how we could do better as a society to recognize, not just treat, but recognize the need for help.
Well, I think one of the ways would be, especially in the professional world, like you said, continuing education is a requirement for most of us. And so offer more of the coursework.
Yes.
You know, just even if it's just the basics and some of the basic signs and symptoms. And I think the other component, of course, is being a good listener. I think we as professionals need to be good listeners and tap in and show empathy. And maybe people wouldn't be as hesitant or scared to talk about how they're feeling and what's going on.
Yeah, a lot of our viewers are seniors and caregivers, and maybe the first time that compromised capacity comes to our audience is through diminished capacity dementia and Alzheimer's, the diseases associated with aging. Let's talk a little bit about those mental health challenges and how they fit in the general picture of care.
Right. Again, another huge issue, because we have an aging population that are living longer. So that's one of the reasons we see more of the dementias, and there are many dementias. It's just that everybody has a tendency to call it Alzheimer's. But there's vascular and there's Lewy body, and you know, there's, depending on who you talk to, there's as many as 200 different types of dementia. Alzheimer's is the most common, though. 60 to 80% of the dementias are Alzheimer's. And so what happens? They start with memory deficits. Some of the other things that happen, besides forgetting, they miss appointments. They kind of lose interest in their personal hygiene. They're wearing the same clothes all the time. They're not necessarily bathing. If they balanced their checkbook, they quit balancing it. You're going to see a stack of unpaid bills, and they're getting notices in the mail. And this is really when people and the family do need to step in, because clearly they need some assistance. And then, unfortunately, it is a progressive illness, which leads to death eventually if something else doesn't end up killing them before the dementia runs its course. But they need, they're going to need more as it progresses into middle stages. They're going to need help with their activities of daily living. They're going to need help, and then eventually it gets to the point where they're bedridden and they're not able to communicate. And so it's very sad. And sometimes they get the behaviors related to dementia where they get very aggressive and they're striking out. And that's where other medications can be used to help with that, the antipsychotic medications to decrease that aggression. But there are facilities. Not everybody is able to take care of them at home, but and they usually would need hired help to continue keeping somebody at home, especially if they're working. But there are assisted living facilities and memory facilities, and we're just going to see more of it as the population continues to live longer and ages, because the risk goes up the older we get.
Yes, and since we're talking, because it feels to me like memory care simply hasn't caught up with the incredible medical advances in our physical care. So since we're talking about seniors and dementia, do you want to give a shout out to your beloved PLOWs? And is that a resource for our viewers? And what are the resources in general for those who may be experiencing either themselves or a family member with some form of mental illness?
Right. Well, PLOWs is a great asset as long as you're within their townships. That they, and of course this area is part of the PLOWs area, but they do have care managers that can assess. They're going to have, they do have social workers even that can go into the home and perform, some assessments and therapy. They've got a lot of services. They've got the Meals on Wheels benefit. There's just so much help available, and it's for people 60 and older. And the other wonderful thing about PLOWs is that it's not based on financial need. So anybody in the area that has those kinds of needs can call PLOWs and work with them.
And getting back to anyone who's under 60, those kinds of moods and personality and autism disorders we were talking about earlier, if someone in our audience or in their family needs help with one of those issues, where would they go? What would their first call be?
To me, they really should be talking to their primary doctor. If they see their primary doctor on a fairly regular basis, you can start there. Now, some patients, that's as far as they want to go, and so their primary doctor will prescribe a lot of these medications. However, I think it's best that they ask for a referral to a psychiatric professional, whether it be the psychiatrist or, again, the psychologist, a nurse practitioner. And sometimes you can start with therapy, and then they can get you in quicker to a psychiatrist if medications need it. Because unfortunately, doctors are not choosing psychiatry as often as some of the other specialties anymore. So we really do have a shortage.
We do.
We do have a shortage. But there's other facilities in the community. Metropolitan Family Services is here in Palos. And they will do sliding scale even if people don't have insurance or the means to pay. Thresholds is another organization that helps people in the community. Unfortunately, we've lost a lot of our community mental health centers, due to the budget crisis in our city and state. But there is help available.
Yeah, and I think that's one way we could use our voice to make sure that if we have an increased need for mental health, we certainly don't want diminished services. So all of us speak up for our loved ones. How about any final words of wisdom or maybe hope for our families who feel a little bit of despair about the mental illness?
Well, one of the other organizations that I'd like to bring up is called NAMI, or NAMI, N-A-M-I, and that's the National Alliance for Mental Illness. And they are all over the place. There are groups all over the place, even in our south suburbs. And so they not only help support and educate the person with mental illness, but they work to support and educate the family members. And so that's real important.
Absolutely.
And then look for recommendations. Talk to people that you feel comfortable with and trust and see if they know of somebody. Because again, you're sharing your most inner feelings and difficulties and challenges. And so you need to be able to trust the person that you're talking to.
Beautiful. Lots of resources. Thank you so much, Maureen.
Thank you.
That was very wonderful and much, much needed advice. And thank you, viewers. Let's remember that our loved ones who do have mental health issues need our compassion and our help as much as those who have a physical condition. If you need help, reach out. It's there. Thank you for watching, and we will see you next time on Where the Road Rises. Goodbye.